Hi, I'm Dr. Ezekiel Melquist, and I'm a pediatrician, board-certified pediatrician, and I work at the Mason Health Clinic as well as the hospital. I was born in the UK, but I grew up around here. So I did my undergraduate education locally here. I went to the Evergreen State College, and then I moved to the Bay Area and I actually did a master's degree in electronic music. And while I was there, I learned about a post-bachelor pre-medical program. So I did that at San Francisco State. And then I moved to the UK, to London, and I went to medical school there. And I spent a year as a doctor there before coming back to the States and pursuing my pediatric training. In Brooklyn, New York, I was at SUNY Downstate. One of the things that drew me to being a doctor was the idea of helping people and helping make people healthier and happier. I wasn't initially drawn to pediatrics, but when I did my pediatric rotation, everyone kept telling me I was good at it and I was enjoying myself. I liked the people I was working with, and so it called to me, and here I am. I can be a bit of a goofball with them, and they appreciate it, parents appreciate it. It kind of lowers everyone's anxiety when kids are sick. That said, I take taking care of kids very seriously, but I do like to goof around and tell jokes and distract the kids with a bit of humor. What's green and has wheels? Grass. I was lying about the wheels. First introduction I had to Mason Health was through the physician wellness program and hearing about that, and just sounded very appealing. The idea of being somewhere where the wellness of the provider community is a priority. The values of this organization very much aligned with mine. Talking with the senior leadership, I like their approach, their style, as well as the way they have led the organization for the last several years through some very difficult times. So supporting the place where I work is important to me, and supporting a lot of the mission of the hospital is important. And it's also fun to be out in the community doing things and getting involved in that way, and also having some of the patients and families see me outside of the clinic. It might inspire some other child to think, oh, you know what, I want to dress up as Batman and go, hang out at the Halloween fair. A fun thing to do is go on a nice long bike ride with the Bikers for Babies program last year, and I'm going to do it again this year. And that was a load of fun. Biggest things is I really get to know my patients and my families that I'm working with, and get to know what they're going through.